بسم الله الرحمن الرحيم وصلي وسلم على أشرف الله محمد بن عبد الله وعلى آله وصحبه. السلام عليكم ورحمة الله and welcome everyone in this online session, which inshallah we are going to finish the cardiovascular and pulmonary system imaging. Last week on face-to-face session, we started this part. We discussed the different imaging modalities that used in assessment of this system, and also we discussed the anatomy in different images such as X-ray and CT, and then we discussed some radiological signs that can be seen on the chest X-ray, such as air bronchogram and silhouette sign and consolidation. And then we discuss the causes of increased density on one side, which is called obesified hemothorax. We discussed how to differentiate between the causes of this abnormality. So today, inshallah, we are going to. I think we stopped here in the different. We lost. This is the last slide that had been discussed. Then the difference, the main difference between collapse and consolidation, as you know, both conditions causing increased obesification of hemothorax. Consolidation and collapse are differential diagnosis of increased obesification of hemothorax. In collapse, in addition to increased obesification, there is a loss of lung volume. The lung volume gets smaller, and there is a shift of mediastinum towards the side of collapse. So it is called ipsilateral shifting, and there may be, or they may not, there will not, air bronchogram may be seen or may not be not seen. Yeah, in some cases we can see air bronchogram in cases of collapse, and this is called collapse consolidation, in which there is air bronchogram, but collapse sometimes may be the air bronchogram sometimes may not be seen in the collapse. But in consolidation, the air bronchogram should be seen, but the mediastinum in its normal place, there is no shift of trachea or of the mediastinum toward left or right side, and the lung volume within normal, there is no increase or decrease lung volume, in addition to presence of opaque hemothorax. Also, this is the other cause of increased obesification of hemothorax. زي ما اتفقنا انه كل differential diagnosis of obesification hemothorax بتلقى one side obesified. This is a normal side, loosened. Right side is loosened. The left one is abnormal because it becomes obesified. There is increased obesification of left hemothorax. So you have to put the differential diagnosis that has been explained: pneumonia, collapse, pneumonectomy, agenesis, and the pleural effusion. And you have to look to the signs: legumination, lung volume, and air bronchogram, and shifting of mediastinum. In this one, there is the obesification of left hemothorax, and there is a decrease of lung volume. The right one is increased, and as a compensatory mechanism. On the left one, there is a decrease of lung volume, and there is a shifting of mediastinum. This is trachea. Trachea should be in midline or slightly deviated to the right, but in this case you can see the trachea is shifted towards the left side, بيسموها towards شنو ipsilateral side. And in this case also you can see there the rib number 5. This one is absent. If you look here, this rib is resected. So there is evidence of surgery, resection. So this patient underwent pneumonectomy, removal of the lung. This surgery done by resection of the ribs, posterior rib. So this 5 ribs is absent or not seen because it is resected to perform the surgery to remove the lung. So this is the pneumonectomy. So this case is pneumonectomy. It is not pneumonia. It is not collapse. ليش قلنا هي pneumonectomy? In addition to ossification of left hemothorax, there is a shifting of mediastinum and decreased lung volume, and there is a evidence of surgery اللي هي absence of rib number 5. This is a pneumonectomy case. This is other cause of ossification of one side. The right side is ossified. So my question: what is there a evidence of air bronchogram or not?
No.
Air bronchogram, is it seen or not within the ossification?
No.
Yes, there is no air bronchogram. زي ما اتفقنا انه air bronchogram يكون عندنا streak line, lucent line within the opacity. But there is no air bronchogram. How about the mediastinum? Is it in place or shifted?
Shifted contralateral.
Yes, it is shifted to contralateral side. It is pushed to other side. It is not pulled, it is pushed. So it is pushed to other side. This is called contralateral shifting of the mediastinum, and also trachea. Trachea is shifted towards the left. قلنا here normally in the midline or slightly deviated to the right. لكن now it is deviated to the left, and the heart is shifted towards the other side. There is the mediastinum shift towards the other side or contralateral side. So what is your diagnosis?
Lung collapse.
Lung collapse. لو تحصلوا قلنا lung collapse, yes, you can see the ossified hemothorax, but what about the mediastinum in case of lung collapse?
Ipsilateral.
Yes, but in this case you can see there is a contralateral. So what is the diagnosis? Which causing this mediastinum to be shifted, يعني pushed by what?
Fluid or?
By fluid, yes. Where is this fluid?
Right side.
In which place?
Pleural cavity? Or?
Yes, it is in pleural cavity. So this is what is this condition? When there is a fluid in the pleural cavity.
Effusion.
Yes, this is a pleural effusion. So this is a pleural effusion. ليش قلنا pleural effusion؟ أول شيء عندنا هنا ossified one side اللي هو ossified right hemothorax without air bronchogram, with shifting of mediastinum tract to the other side. So this is لأنه الفلويد هي بتعمل لنا pushing to the mediastinum to the other side. So لو لاحظتوا this is the only one cause is that causing shifting of the mediastinum towards the other side. لأن عندنا pneumonectomy تعمل لنا towards ipsilateral and collapse also towards ipsilateral, and in pneumonia there is no shifting. So this is the pleural effusion. طيب لأن نتكلم فيها عن pleural effusion, if the patient يعني pleural effusion ممكن يكون عنده many causes, may be caused by pneumonia, heart failure, or يعني tuberculosis. Many conditions can cause pleural effusion. The standard initial imaging modality for detection of this pleural effusion is usually plain X-ray. لكن اللي هو in the plain X-ray in the standard standard plain X-ray اللي هو قلنا بتكون PA in erect position. But sometimes if there is a small amount of fluid in the pleural cavity, يعني عندنا small amount يعني as low as 5 milliliter, this is a small amount. In the standard film in the erect, this quantity 5 ml is not seen on the standard PA erect chest X-ray. So you have to put the patient on his side، يسموها lateral decubitus view، يعني البيشنت ينام على جهة واحدة على side. And this allow to detect small fluid. يعني with this position you can see the even the 5 milliliter fluid in the pleural cavity that cannot be seen in the frontal. طيب نحن بلوري فيوجن هي اللي عرفنا دي اذا كانت ماسيف بلوري فيوجن بتكون بالشكل زي اللي هي بتوكسيفايد رايت مسار. Sometimes بلوري فيوجن may be of moderate amount، يعني ما تكون كميه كبيره زي دي. This is characterized by this sign. لاحظ انه there is a fluid here. There is a fluid here. دي بيسموها meniscus sign. يعني هنا عندنا زي شنو؟ اللاترال and medial sides بتكون شنو؟ higher than the شنو؟ middle side. دي بيسموها meniscus sign which is the sign of pleural effusion لما تكون الاماونت هنا moderate. But here in the massive pleural effusion. طيب احيانا بيكون عندنا small fluid small amount اذا عملنا frontal او lateral. كان عندنا small amount this characterized by obliteration or blunting of this angle اللي هي what is this angle؟
Costophrenic.
Yes, costophrenic angle. يعني معناتها اذا عندنا small fluid this causing شنو obliteration or شنو blunted بيسموها شنو costophrenic angle، يعني بدل تكون sharp angle زي ما وضحنا لكم في النورمال زي دي كده بيحصل لها شنو blunted، بتبقى هي شنو يعني obscure or شنو يعني بتبقى هي not acute angle. اذا عندنا 3 degree of pleural effusion. If it is small it causing شنو blunted or شنو blunted or شنو obliterated costophrenic angle. إذا كانت moderate بتكون لنا بنفس الساين دي meniscus sign. إذا كانت gross large amount بتكون causing شنو ossified one side and causing the deviation of the mediastinum to the other side. But this is how to diagnose pleural effusion on radiograph by X-ray according to the quantity. اللاست هنا ده عندنا اللارج اماونت عملت لنا complete classification with shifting of mediastinum. moderate meniscus sign. اذا كان small ما عندنا لا ايمج لازم تلقى البلورال effusion الكوستوفينيك انجل blunted or شنو obliterated. طيب this pleural effusion also can be diagnosed by simply by ultrasound and by CT. فعندنا ultrasound can be used or CT. pleural effusion طبعا هي fluid density. But this is a fluid density seen between the lung and the chest wall. But this fluid is accumulated in the pleural cavity as a fluid density. But CT can be used for detection of this pleural effusion. And with CT you can differentiate between this pleural effusion and pleural effusion sometimes بيكم شنو باللورة شنو بيحصل لها انفكشن بتبقى امبايما and with abscess. يعني مرات بيكون عندنا difficulty to differentiate between pleural effusion when it gets infected اللي هي امبايما and the lung abscess. دي هنوضحها لكم في السلايد اللي بعدها تقريبا. إذا CT can be used for the diagnosis of شنو pleural effusion and also help us in the differentiation between the empyema and lung abscess. هنشوف الساين اللي هي can be help us in differentiation between these two conditions. Ultrasound also can demonstrate this fluid. يعني تقريبا about 25 milliliter can be diagnosed by ultrasound. But this is also fluid. الفلويد زي ما قلنا في الالتراساوند دايما تكون anechoic totally dark. بس ultrasound طبعا simple technique. يعني you can take the ultrasound machine to the patient bed and diagnose this pleural effusion. So it is a simple method for identification of the pleural fluid or pleural effusion if it is there. And also it can be used for aspiration of this pleural يعني under guidance يعني you can insert a needle or catheter towards this collection under control of the ultrasound يعني إذا هي بتساعدنا أيضا for شنو drainage for the treatment or for aspiration حتى إذا بدنا نعمل aspiration for cytology. لاحظوا إن الفلويد أهم شيء إنه شنو anechoic between the شنو lung and the chest wall. أيضا هنا الفلويد هي الفلويد density in CT. نجي حقولنا CT can differentiate between lung abscess and empyema. empyema بكون حصل لنا infection in the pleural fluid pleural effusion حصل لنا تكون get infected. فدائما بتكون لنا عندنا difficulties to in differentiation between these two conditions. But this is CT for different patients. This is a CT for patient 1 and this is CT for patient 2. You can see this is a collection. This is a collection. This collection localized between this layer and this layer. What is this layer? اللي هي pleural layer. This one and this one. احنا قلنا there is a two layers of pleura. ايش هما؟
Visceral.
Visceral and
red one is
parietal. This is a parietal, the red one is parietal, and the blue one is visceral. Here again is the viscera, and this again is the chest wall. There is a fluid in this between these two layers, but this is a fluid. يعني ممكن تكون إذا كانت fluid pure fluid بيسميها pleural effusion، لكن it gets infected فthis is a empyema. فإذا لما يكون عندنا empyema characterized by شنو؟ تحصل enhancement of the layers اللي هي of the visceral and parietal pleura. نحن المفروض كان أجيب لكم صورة من غير الكلر دي، لكن حتلقى إن البلورال دي حصل لها شنو enhancement بقت بيضاء. both pleural are enhanced and between the two pleural اللي هي الفيسرال parietal there is a شنو collection، لكن أهم شيء the shape of this collection is lenticular in shape biconvex يعني بس this is بيشبه اللينس العدسة بس this is a biconvex and also this is a biconvex يعني دي محدب ودي محدب biconvex. both images demonstrate شنو empyema. عرفنا كيف empyema؟ لأنه عندنا fluid collection between the two enhancing two pleural layers with characteristic shape اللي هو lenticular shape biconvex shape. this is called pleural empyema والساين دي بنسميها split pleural sign. split pleural sign. so split pleural sign اللي هي ايش يعني؟ اللي هي بيحصل thickening and contrast enhancement of the both pleural parietal and visceral. in between them there is a collection وبتكون ال shape of this collection is is biconvex or بيسموه lenticular in shape. طيب إذا كانت abscess الشيب ما بيكون lenticular بيكون rounded circular in shape. فنحن بنعرف إنه this is abscess. ما عندنا abscess in this image لكن عندنا later فالabscess بيكون rounded. فإذا the difference between CT can differentiate between lung abscess which is round in shape and pleural empyema which is characterized by split pleural sign which refer to thickening and contrast enhancement of these pleural, parietal and visceral and fluid between the two layers. طيب السلايد ده طبعا هو دايرين نوضح بها الديفرنشال دياجنوز هاو تو ديفرنشيت. يعني تكلمنا عنها الاتلكتيسيس بلورال افيوجن نيمونيا والنيمونكتومي. دي الديفرنشال دياجنوز. الاتلكتيسيس اهم شيء فوقه shifting of the mediastinum ipsilaterally and in pneumonectomy also there is a shifting of mediastinum ipsilaterally, but in pleural effusion there is a shifting of mediastinum towards the other side, and in pneumonia there is no shift. Be concerning the shifting. طبعا كلهم characterized by ossification of one side, ossification of hemisthorax. طبعا النيومونكتومي زي ما اتفقنا بيكون في evidence of surgery, usually rate 4 or rate 5 usually resected to perform this technique. طيب كده خلصنا ossification of one side. طيب احنا قلنا both lungs should be symmetrically loosened لوسن يعني يكون ما يعني سواد مع انت بتكون بتشوف النورمال كثير بتاعت انه this both sides should be symmetrically in lucency. هسه الان خلصنا عن ايش؟ انه اذا حصل increase opacification of one side sometimes there is increased lucency يعني تبقى more hyper بيسموها hyperlucent more lucent or hyperlucence of one side. زي ما قلنا المره اللي فاتت عندنا differential diagnosis one of these differential diagnoses is pneumothorax. Pneumothorax is the condition characterized by accumulation of air within the pleural cavity. Patients that present with pneumothorax usually present with sudden onset of dyspnea. بكون في ipsilateral chest pain يعني according to the side. إذا كان عنده right side pneumothorax هيكون عنده right side chest pain. If it is in the left, the patient present with left side chest pain. يكون عنده patient present with breathing sound diminish. Diminished breath sound. This is on examination and hyper resonant on percussion. Hyper resonant. By the way, on percussion on the on the pleural effusion, if the patient present with pleural effusion, massive pleural effusion, what is the finding on percussion? What will
dullness.
Yes.
Dullness on percussion.
Yes. Because there is increased dullness بيسموه stony dullness. يعني مع البركشن بيكون في increased dullness. But in the pneumothorax there is hyper resonance لأنه في air بيكون hyper percussion بيكون hyper resonance. فإذا there is a hyper resonance on percussion on the affected side. طيب pneumothorax أحيانا بتكون بيسموها single pneumothorax sometimes بتكون بيسموها tension pneumothorax. طبعا patient with tension pneumothorax بيكون distress بيكون عنده hypoxia بيكون distress يعني بيكون shortness of breath و unstable hemodynamically unstable النيك فينز بتكون distended ف it is an emergency condition tension pneumothorax. So it is a life-threatening condition and any patient suspected tension pneumothorax what should be done for this patient immediately. إذا كان patient suspected tension pneumothorax جالس in the ER جا patient بالسيمتوم اللي اتكلمنا عنها دي dizziness distended neck veins distress examination hyperresonance what should be done for this patient immediately to relieve this distress? You have to insert a needle.
Decompression.
Yes, decompression اللي هو how to do this decompression. طبعا هو ما مطلوبين منه لكن اللي هو you have to insert a needle as the mid-clavicular line as the second intercostal space to relieve the شنو بتعمل decompression. ده بيسموه initial treatment of tension pneumothorax. ده initial treatment لكن طبعا لاحقا هنعمل له شنو chest tube لكن you have to insert a needle to relieve this اللي هو decompress the lung يعني البيشنت بيكون hypoxic وديستريس وكده يعني هي لايف ثريتنينج. حتى ما ترسلوا انه يعمل شنو ايميجينج لانه this is a life threatening. هنيجي نوضح الكلام ده. فهو النيوموثوركس كان بي دايجنوز. اذا كان سيمبل نيوموثوركس ممكن البيشنت تعمل له تشست اكس راي تو كونفيرم ذيس pneumothorax. Ultrasound sometimes may be now done for identification of pneumothorax. يعني you can see the pneumothorax by ultrasound. طيب but طبعا CT in addition to demonstration of pneumothorax can demonstrate the causes of this pneumothorax. لأن pneumothorax ممكن تكون هي spontaneous ممكن تكون due to rupture of pulley مثلا sometimes يحصل لنا pulley rupturing. فهي CT help in addition of diagnosis of pneumothorax can demonstrate شنو the cause of this pneumothorax. طيب نحن زي ما قلنا tension pneumothorax is clinically diagnosed اللي هي زي الفيتشرز اللي قلناها دي عشان يجي بالسيمبتوم دي بنعرف انه this is a tension pneumothorax. So this patient required immediate decompression of the lung. ما in case of tension pneumothorax immediate decompression is priority. Should not be delayed by imaging. يعني ما تقول انها مش عارف to confirm this pneumothorax لانه تكون very distressed. So the priority is decompression of the lung by insertion of the needle. طيب نشوف يلا بعدين. احنا ما اتكلمنا على الساين. المهم عندنا الساينس اوف pneumothorax in imaging radiology. طيب تتوقعوا ايش الساينس اوف pneumothorax اذا عندك دي this image؟ ايش what are the findings؟ طيب what side is abnormal in this image؟
Hyperlucent.
Yes, hyperlucent. طيب in this image which side is hyperlucent؟
Left side.
Yes, the left side. The left side is hyperlucent. لاحظ ان المنطقة دي hyperlucent, very black compared to the other. طيب what is this؟
blood vessels.
Yes, where is this blood vessels? You are right. Where is this blood vessels?
Around the heart.
In which structure? Are they
Mediastinum.
mediastinum? Yes. طيب do you see the lung in this area?
Yes, doctor.
Where
Yeah,
is
the
it?
big.
Yeah.
Yeah, we can't see the blood vessels here.
Where? Here?
Yeah, up above.
Above? Here?
Where?
Look between the ribs. Can you see the blood vessels? يعني compare. طيب
No.
compare this area with this area.
No blood vessels seen.
No
Like
blood
less
vessels.
than.
Why is there is no blood vessels?
Because the pneumothorax.
Lung volume
Where is the
decrease.
blood
Because of air.
Yes, this is air. Where is this air? موجود وين؟ In the
In
lung.
the pleural cavity.
Yes. So what is this structure يعني؟ دي ايش؟ شايفينها دي؟
Lung.
This is the lung. It is ما حصل لها شنو؟ compressed
Decreased volume.
ليش حصل لها compressed؟ لأنه إذا تابعنا هنا this is the visceral pleura. أنا I follow the visceral pleura. This is a visceral pleura. This is a visceral pleura. So this is the lung. Where is the parietal pleura? Parietal pleura is again is the chest wall. Between the parietal pleura and visceral pleura, this is a space اللي هو filled by air. تلاحظ إنه this is all this is air. حتى بتلقى المنطقة هي شنو smooth hyperlucent ما في any بيسموها شنو with absence of lung marking. بنعرفها كيف؟ لأنه there is no blood vessels. blood vessels هنا موجودة لكن هنا there is no blood vessels. If you compare the normal site دي blood vessels موجودة على كله لكن هنا there is no blood vessels. So there is a hyperlucency with absence of lung marking. عرفنا كيف there is no lung marking because there is no blood vessels. blood vessels موجودة هنا and at the area of the compressed lung. فاللung هنا حصل لها compression medially by this air. فthis is a pneumothorax. فالاير ده موجود in the pleural cavity. So in the pneumothorax there is ipsilateral pleural line اللي هي المشاهد عليها دي with the reduced or absent lung marking في المنطقة اللي فيها الاير دي اللي هي لذلك بتكون there is increased lucency اللي يسموها increased transparency or increased lucency or it becomes hyperlucent. become hyperlucent. There is abrupt changes in radiolucency. يعني المنطقة هي دي كانت لاحظ ان هنا في lung marking لكن هنا there is abrupt changes. بتبقى هي المنطقة very black. But this is a signs of pneumothorax. أهم sign في pneumothorax شنو؟ إنه يكون عندنا hyperlucency without lung marking. There is no lung marking. تلقى اللنج هي compressed medially. طيب دي إذا كانت simple pneumothorax. أما إذا كانت في tension pneumothorax في ساينس معينه بنعرف ان البيشنت دي intention pneumothorax اللي هو characterized by on the imaging flattening and inversion of the show of the diaphragm قلنا ده شكله كده. لكن اذا كان في tension pneumothorax هسه الان there is no tension. لكن اذا كان في tension pneumothorax تلقى الديافراغم ده يا شنو يا straight يا المهم compress or شنو push downward. And also the heart and mediastinum also sometimes push to the other side. This is a sign of tension pneumothorax, which is a flattening or invasion of the ipsilateral diaphragm, and also there is intercostal space widening, and the spaces between the costal increase لأنه حصل hyperinflation of the البلورال cavity دي جاء air كثير، بالإضافة زي ما قلنا إيش mediastinum shifting and also tracheal shifting. This is in case of tension pneumothorax. الساينس اللي تكلمنا أخيرا دي اللي هي على الديافراغم هو flattening or inversion, widening of the mediastinum of the lateral side, shifting of the mediastinum and trachea in case of tension pneumothorax. لكن simple pneumothorax بس بيكون عندنا increase hyperlucence اللي هي hyperlucence of one side. طيب زي ما قلنا هنا النيوموثوركس also can be diagnosed by CT. Which side is normal, left or right?
Left.
No, left. So the abnormal is right. Where is the abnormality? What abnormality do you see?
Anteriorly to the right.
Yes, there is a. What abnormality do you see? There is موجود
no lung markings.
Yes. And what is this?
Compressed lung. Air.
Air. So air on CT. How air appear on CT?
Hypodense.
Hypodense. But so this is the air in the pleural cavity. Now this is the visceral pleura against the lung, and the parietal pleura against the chest wall, and the air accumulated in this pleural cavity. So this is the right side anterior pneumothorax. There is right side pneumothorax. لاحظ هنا there is no lung marking، لكن هنا lung blood vessels, you can see the blood vessels and the lung parenchyma. So this is a pneumothorax. طيب, anyone can interpret this image? Yes. Like, what is the imaging? What is this exam?
Doctor, this is plain X-ray.
Yes, plain X-ray of what? Skull.
The chest.
Yes, this is plain X-ray of the chest. Yes, all right. What describes the abnormality?
Hyperlucent in the left side.
Yeah.
The lung is compressed or not?
Yes, lung is compressed medially.
Medially.
Lung, and do you see lung marking in the hyperlucent area?
No, there's no lung, no blood
vessel. Or yes. طيب, as this area, or what is this sign? radiolated sign تكلمنا عنه تقريبا.
obliteration.
Yes, هو there is obliteration، لكن لاحظوا انه هنا في straight line ده بسموه ايش؟ طيب.
lobar consolidation of a lobe.
طيب, I mean other words. طيب, what is قلت هنا there is air. This is air, and what is the material or the composition of this area? What do you see in this area? Is it also air?
No, soft tissue mainly.
Soft tissue زي ده يكون كده.
Fluid.
أيوة, this is fluid.
Okay.
This is fluid. So in this pleural cavity there is air and fluid. Both air and fluid. عرفنا في air and fluid كيف؟ طيب, how do you know if there is air and fluid? طيب, إذا عندك air and fluid in
the air floating on the fluid.
Yes, Yes, usually the air in the erect مثلا يجي زي أي كوباية جلاس مثلا حطيت فيها air and fluid. The fluid usually goes down and the air goes up. So there is a line separating between the two material, between the fluid and air. بيكون straight. طبعا الفلويد بتكون في السطح الأعلى بتاعه بيكون straight and the air above it. ده بيسموه air fluid level. This is the line ده اللي هو شنو؟ اللي يسموه air fluid level. The line separating between the شنو؟ the air and fluid. air fluid level. فعرفنا إنه هنا، لكن لو لاحظت هناك هنا كان في air only. There is no fluid. لكن in this one there is air, both air and fluid. عرفناها كيف؟ لأنه عندنا شنو؟ straight line separating between the two density, between the fluid below the bottom and air above. So what is this condition called?
hydrothorax.
hydro ايش؟
لا.
hydro
pneumothorax.
ايوه hydro pneumothorax both. إذا عندنا air only بنسميها pneumothorax. إذا عندنا fluid بنسميها fluid fusion or hydrothorax. إذا both air and fluid بنسميها hydropneumothorax. hydropneumothorax. This is the hydropneumothorax. طيب this is also chest X-ray of the patient involving road traffic accident. What striking abnormality do you see? طيب what abnormal?
hyper.
Yes.
لا.
I was gonna say subcutaneous emphysema.
Yes. What are the signs of subcutaneous emphysema do you see? Why there is a subcutaneous emphysema? What sign do you see to confirm your diagnosis? عرفنا كيف إنه how to diagnose subcutaneous emphysema on the plain X-ray. What sign do you see? Look to this chest X-ray. Look to the soft tissue here. Look to soft tissue. What is the density of soft tissue? The muscle.
Gray.
Gray. Yes. Compare this with this one. Is it grayish? And this one. Is it still grayish?
It's air under the skin.
Yes.
Hyperlucent.
Yes, there is a streaky lucency in the subcutaneous tissue. في اللحظة المنطقة دي بدأت تكون زي ما قلنا المصل دي دايما بتكون جرايش. أي مصل تكون جرايش، لكن and there is no air. There is no air. ممكن تلقى سواد شوية. ده شنو من الفات subcutaneous fat. لكن in this one there is a lucency. This streaky lines of lucency. This is due to accumulation of air in the soft tissue. In the soft tissue, the air escape from the pleura, from the lung, and due to مثلا يكون حصل له due to this accident يحصل لنا شنو ممكن fracture of the rib penetrating the pleura and the lung. The air escaping from the lung and accumulating the subcutaneous tissue. فدي لاحظوا المنطقة دي كلها دي فيها شنو؟ air, subcutaneous air. سموها subcutaneous emphysema. So this is a patient involved in road traffic accident, and this chest X-ray demonstrates the traumatic subcutaneous emphysema characterized by linear lucency. يعني خطوط سوداء linear lucency in the soft tissue. All soft tissue. In all soft tissue there is a linear emphysema. طيب نتكلم عن الفيزيما. زي ما عارفين ان الفيزيما is one of the chronic obstructive lung disease. يعني chronic obstructive lung disease may be emphysema or chronic bronchitis. Emphysema is the most common cause of يعني caused by smoking. يعني البيشنت chronic smoker can develop this emphysema. To diagnose this emphysema by the imaging, we can do chest X-ray. But this is chest X-ray of emphysema. فدايما نعرف what signs of emphysema do you see. طيب, what about the heart? Is it normal? It looks normal? يعني نفس دي مثلا وثان دي.
No.
As if it's rigged or.
Yes. The heart is is elongated. يعني بيبقى شكله على طول كده elongated and compressed, narrowed and elongated. This is concerning the heart. Is elongated and narrowed. And if you look to the lung volume تلقى انه عن اللنج ما بيسموه hyperinflated. يعني حتى extended down يعني تقريبا below the last rib. Hyperinflated of the or increased lung volume in both sides. And the diaphragm, لاحظوا الديافراغم قلنا المفروض بيكون شكله زي التنت كده، لكن هسه الآن معلوم push down. Diaphragm is pushed down and low in position. And also you can see there is increased lucency. منطقة فيها increased lucency especially in the superior zone. ولاحظ انه زي اللنج ماركن ذاتها قلت هنا especially in the superior. يعني لاحظ اللنج ماركن هنا موجودة in the bottom, in the base, لكن in the apex and the superior zone the lung marking is not clearly seen. يعني the blood vessels يعني. So this is the features of emphysema. أهم شيء إنه نعرف إنه هي البيشنت يقدر يكون smoker. طيب الفايندنجز بتكون عندنا increase lung volume. لاحظ إنه lung بقت increasing volume in both sides. The diaphragm is pushed down. Diaphragm is pushed down. يعني إذا مشيت شفت النورمال diaphragm بيكون شكله دائما هو يعني السنترال بارت بتكون هاير كده. ولكن هنا push down. This diaphragm is pushed down and almost become flat. Heart is elongated and narrowed. The intercostal space increase. يعني the space between the ribs is increased due to hyperinflation of the lung. But this is a sign of emphysema on chest X-ray. طيب في حاجة اسمها البولي اللي هي pocket اللي هو أصلا هي الانفيزيما بيحصل destruction of the wall of the alveoli. بيحصل escaping of the air تعمل لنا pocket of air collection. فدي بسموها البولي. بس this بولي can be seen on the chest X-ray زي دي مثلا. يعني بتلقى إنه عندك زي wall كده والمنطقة هايبرلوسد. Also can be well demonstrated on CT. فدي all these are bully اللي هي cavity of air. هي كلها بسموها البولي أو البولي الواحدة بولة. ف this is the sign of emphysema. إذا السي تي يجيب سي تي دي جبناها ليش؟ عشان تعرف إنه زي بولة اللي هي air cavity. Bronchiectasis. What is bronchiectasis؟ يعني ايش bronchiectasis؟ What is the pathology؟ لما نقول bronchiectasis, this condition characterized by what pathologically?
Bronchospasm and inflammation.
Spasm.
Bronchoconstriction or thickening of bronchi and inflammation.
Spasm. There is spasm in the bronchiectasis. Bronchial spasm.
No.
No, the opposite, dilation maybe.
Just
Yes, in the bronchiectasis.
dilation.
By irreversible dilatation of the bronchi. Irreversible dilatation. And this patient, this is by definition the bronchiectasis. the patient present with chronic cough يعني لازم يكون عندهم chronic cough with large amount mucopurulent large conspicuous amount يكون عندهم mucopurulent يكون الاماونت كثيره في نفس الوقت chronic cough دي مهمه جدا انه عندهم chronic cough with mucopurulent sputum of large amount and patient may present with other symptoms ممكن يجي بهيمoptysis dyspnea rhinosinusitis فأهم شيء إنه السيمتوم دي مهمة جدا to diagnose bronchiectasis. On examination ممكن البيشنت تلقى عنده tracheal bronchial auscultation and sometimes يكون في wheezes. طيب إذا دايما نعمل X-ray طبعا you can see شنو the dilated bronchi وعندنا عندنا لها كم types البرونكيكتسيس في cylindrical type وفي circular types يعني according to the shape of the dilated bronchi and also can be diagnosed by CT لما نجي to diagnose this لكن هي CT is more sensitive يعني X-ray may be normal يعني احنا بنعملها as the initial test but sometimes or common it is usually normal may not show the especially the mild cases لكن CT is very sensitive especially high resolution CT اللي هي done with you know section very small section high resolution CT طيب on CT like this طيب if you look what is this مثلا دي او دي ده اي مشاكل
bronchioles.
yes this is البرونكيال حصل لها ايش هي زيت نورمال زيت نورمال
damage.
طيب what is this structure immediately close to the bronchi حصل في structure دي مثلا او دي مع what are these this what
Arteries?
ايوه this is the heart this is the blood vessels so if you اذا عملنا سي تي بتلقى شنو dilated البرونكس with accompanied blood vessels ده البلاد فيزل فالساين دي بيسموها signal ring sign pulmonary artery with bronchi يعني تكون عندنا مع كل برونكاي بتلقى البلاد فيزلز اللي هو الدايليتد برونكاي طبعا and برونك فالنورمالي المفترض النورمال برونكاي الريشيو يكونوا ايكوالي فالان حصل شنو دايليتد برونكاي فزادتين الريشيو برونكو ارتيريال ريشيو انكريز فبقت البرونكاي diameter more than the blood vessels فدي بيسموها شنو increase bronchotracheal ratio اللي هي حصل لنا thickening of the wall of the bronchi فأهم حاجة تعرف إنه this is بيسموها signal ring sign يعني كأنه الخاتم ولا شنو ده موجود عليه شيء في الطرف كده زي الماظة كده وشنو بيسموها signal ring sign فكأنه ده الخاتم ودي مثلا ده الخاتم وجنبه هي زي الماظة ولا كذا حاجة كده فإذا دي يسموها signal ring sign مهمة جدا this is signal ring sign طيب أحيانا بنشوف شنو in the chest X-ray أو in the CT بنلقى الساين especially إذا عملنا مثلا coronal أو in the chest X-ray بنلقى حاجة اسمها tram track sign تلقى إنه كأنه عندك كأنك الطريق بتاع شنو train tram track sign also is a sign that can be seen on the X-ray or CT إذا عرفنا tram track sign and the شنو signal ring sign دي المهمات جدا in diagnosis of bronchiectasis. نيجي لكونديشن other condition نحن زي ما قلنا إذا البيشنت عنده نيمونيا بس مثلا ممكن يكون يحصل له consolidation اللي هي consolidation بتكون opacity with air bronchogram دي مثلا البيشنت حصل له opacity with air bronchogram then later develop شنو air in the center of this opacity air in the center of this opacity and you can see الساين دي قلنا ايه دي عندك air above of fluid below
air fluid level.
air fluid level this is air fluid level إذن this is the شنو cavitary cavitary lesion in the lung formed by the abscess نعرف الابسس ده بيتكون كيف الابسس في البدايه بيكون lung pneumonia عاديه يعني يكون عندنا يحصل شنو infection such consolidation with air bronchogram. Then within the lung بيحصل لنا شنو air accumulation and then develop شنو air fluid level. This is the stage of lung abscess. Lung abscess characterized by this stage. Consolidation, air, cavitary air or air in the center and their air fluid level. But CT is better than and sensitive than chest X-ray in demonstration of this abscess. يعني the patient عنده abscess CT يعني can demonstrate this abscess earlier and better than the X-ray. ايضا لو لاحظتوا عنده شنو عندنا زي ليجن دي عندنا air in the center وعندنا الكافيتي دي فيها air in the center وعندها wall. Also this is a CT with the distal window and this is CT lung window, lung parenchymal window. لاحظوا اهم شيء عندنا شنو cavitary lesion containing air وعندنا شنو chest wall. احيانا بنشوف الفلويد level برضه air fluid level in the CT. اذا this is CT demonstrate the lung abscess and this is plain X-ray يعني دي close up images not a chest X-ray يعني هي جايبين for demonstration يعني تعرف انه فقط بس how to the lung abscess is formed. طيب النكست سلايد دي مهمه جدا لانه هي common واهم شيء الناس تفهمها كويس اللي هي اللنج ماسس اللنج نديول. دي لانه common بيجي بيشن ممكن this lung nodule may be discovered incidentally. مثلا بيشن يكون جاء involved in road traffic accident عمليه chest X-ray we can discover this lung nodule او lung abscess. طيب اللنج nodule بتكون usually less than 3 سنتيمتر. اذا كانت more than 3 سنتيمتر في ناس بيقولوا فورمال سنتيمتر نسميها ايش؟ نسميها lung mass. طيب فالاهم حاجه انه when the mass is the large size and irregular infiltrating edge nodule indicating our important diagnostic feature suggesting the carcinoma. يعني اذا عندنا بيقولوا اي ماس more than او نديول more than 8 ملم فدي high suggestive of malignancy especially if it is in the upper zone يعني more than 8 ملم and with irregular outline بيسموها speculative outline زي اللي اتكلمنا عنها في الماموجرافي دي. فاذا large size and irregular infiltrating edge is important diagnostic feature suggesting carcinoma, primary carcinoma of the lung. لكن إذا كان عندنا نوديول زي دي لاحظوا إنها دي smooth outline relatively smooth يعني الأوتلاين you can go through it يعني there is no infiltrate there is no speculation it is smooth this is most likely to be benign. This is most likely to be benign. فthis is chest X-ray وضحت لنا شنو highly suspected malignancy in this nodule. ليش؟ لأنها هي with a speculated margin وهاو large nodule and this is on CT. لاحظوا الانفلتريشن اللي هي irregularity أو speculation of this CT. طيب إذا عندنا pulmonary nodule عندنا differential diagnosis may be carcinoma, bronchial carcinoma primary or bronchial carcinoid or it may be benign such as hamartoma or tuberculoma or يعني infected granuloma. It could be metastasis or lung abscess. عندنا others يعني عندنا many other conditions can be a differential diagnosis of this nodule. فنحن دايرين نتكلم بسيط كده عن how to differentiate يعني between these abnormalities. What is this image?
CT.
Is it normal?
No.
What
Many nodules. Yeah,
yes,
nodules.
Yes, there are. How many nodules do you see?
Multiple, uncountable.
Yes, there are multiple يعني uncountable يعني it is difficult to count these nodules. There are multiple nodules in right or left side?
Both lungs.
Both.
Right. So there are multiple nodules of different sizes scattering on both sides. on both sides. But what what is your diagnosis? What might be the cause of this multiple nodules?
Depending on what the cells resemble, they resemble the original site of the metastasis.
Yes, it is. Yeah. طيب تاخذها كقاعده انه multiplicity is usually associated with malignancy. يعني هي دي common يعني احنا دايما لما نلقى multiple lesion in the liver, in the lung, in the brain, almost we put the metastasis or secondaries on the top of differential diagnosis. There are multiple nodules of different sizes مع انهم هم well defined, well circumscribed nodules of different sizes لكن ما large هو small لكن يعني of different sizes يعني واحدة small واحدة intermediate in size واحدة يعني لكن there is no large nodule on both lung but this is most likely to be secondaries metastasis حتى إذا جينا سألنا من الهيستوري حنلقى البيشنت عنده شنو metastasis. طيب also this is a chest X-ray for other patient. What abnormality do you see? Please look to be systematic in reviewing the chest X-ray. Look to the lung both sides, upper, middle, and compare between the two sides concerning the lung يعني. طيب, do you see this lesion?
Yes.
Do you see this one? Or this
Yes.
one?
Yes.
Yes.
Yes. So what do you see?
Nodules.
Yes, there are multiple nodules on both sides. اللي هو opacity, multiple nodules اللي هي multiple opacity pulmonary nodule. Also, it is well defined in both lungs of different sizes. So most likely to be also شنو secondaries. يعني دائما لما نلقى multiple you have to put the malignancy or the secondaries on the top. والhistory طبعا انت حيكون عندك clinical diagnosis. This is other chest X-ray for other patients. What striking abnormality do you see? Do you see any abnormality?
Opacity on the left
Yes.
side.
Where is this opacity?
The upper or middle part.
Yes. Left or right? Is it on the left or on the right?
Left
Middle
side.
and left.
Yes. In the left اللي هي left to the شنو? To the heart and mediastinum. This is the opacity. طيب, can you identify is it in the anterior or middle or posterior mediastinum? Is it in the anterior or middle or posterior?
It's
Seems
left
anterior.
lung. It's in the left lung.
Seems anterior.
It is anterior. Why?
Because the heart border, left cardiac border is obliterated.
Okay. Like how to confirm is it in anterior? What?
Lateral view.
Yes, lateral view. Thank you. To confirm the position of this mass, you have to do lateral view. طيب احنا عندنا differential diagnosis of anterior mediastinal mass. You can guess is it in the anterior or posterior or middle mediastinum is the frontal. But to confirm this, you have to do the lateral. But this is a mediastinal lesion. This is a mediastinal lesion in the anterior mediastinal. The differential diagnosis of this anterior mediastinal mass include the more 5 T's. All start with the letter T. Thymoma or thymic disease or thymoma, thyroid and parathyroid, and triple lymphoma or lymphoma, teratoma, and thoracic aorta. Some more 5 T's, but this is differential diagnosis. You have to memorize these 5 T's which are the differential diagnosis of anterior mediastinal mass. طيب ممكن تعمل طبعا lateral زي ما قال، أو أحيانا في ناس بيعملوا what other modality that can help you in identifying this tumor. نعمل إيش؟ which modality can help you? What is the best imaging modality for assessment of mediastinum?
CT.
Yes, CT. Yes, CT. طيب this is chest X-ray, and for the other patient, or for different patient, the right one and left one. What striking abnormality do you see in the left one? طيب, the trachea is normal or not?
Deviated.
Yeah, in the position. How about the lung compared? Is there any abnormality, lung nodule, or increase or decrease of or abnormal opacity? Do you
No.
see? How about the heart?
No.
How about the hilum? Is it normal?
Yes.
How about the diaphragm?
No.
Normal.
Normal. What about the below the diaphragm?
Lucency.
Where is the lucency?
The below the diaphragm.
Yes. What is the cause of this lucency?
Hyperinflation of the lungs.
ايش الموجود يعني؟ ليه في lucency below the diaphragm؟ يعني في ايش؟
It's like air, maybe.
Air is the lucent, but there is air below the diaphragm. This air الشيب بتاعه شنو بسموه؟ crescentic shape. ده بسموه free air under the diaphragm. Free air under the diaphragm. This condition called pneumoperitoneum. Pneumoperitoneum is characterized by free air under the diaphragm. What is the cause of this air? يعني there are many causes. What is the most common cause?
Perforation of an ulcer.
Perforation of the vesicles, yes. مثلا ممكن perforation of vertical ulcer. Also this is the air under the diaphragm. Free air under the diaphragm. أهم شيء كلمة free، لأنه عندنا air ممكن يكون the stomach زي دي normal، لكن ده بيكون free air under diaphragm. وزي ما قلنا المرة فاتت should be diagnosed by chest X-ray in erect position. طيب هناخد بريك للصلاة ونجي نخلص ولا كيف؟ 10 minutes.
إيه أحسن دكتور.
إن شاء الله نتوقف هنا بإذن الله، و 10 minutes يعني you have to نجي راجعين، يعني نخليها 13 يعني 26 دقيقة، يعني 6 وثلث إن شاء الله، 6 وثلث نجي نبدأ نخلص إن شاء الله بإذن الله. 6 وثلث.